Hello everyone and welcome to RN NCLEX DEX, and I'm happy to have you with me reviewing this NCLEX case study, and we're looking at NCLEX prioritization frameworks, and I'm going to ask you a question of who do you see first? And we're going to get into the scenario, so let's go. So we have a scenario here with an asthma patient who is wheezing and using accessory muscle to breathe. And we also have a patient who is bleeding. This patient has large open wounds and bleeding significantly, but this patient is responsive. So who do you see first? Do you see the asthma patient first, or are you going to see the bleeding patient first? So let's get into the steps that we're going to take in order to answer this question. So number one, we're going to apply the NCLEX priority framework. Number two, we're going to analyze each patient using this framework. Number three, we're going to, based on the information that we have, we're going to use this to determine who we see first. So with the NCLEX priority frameworks, you will see these options labeled from 1 to 6 in their correct order. And as you see, you will see airway, breathing, and circulation. So these are your ABCs, and NCLEX is big on ABCs. NCLEX wants you to prioritize ABCs above all. So you may see at number 4, safety, number 5, pain. You also see at number 6, education, but ABC tops them all. So don't forget that. This is very important for NCLEX. So let's go to step 2. We're going to analyze each patient. So for the asthma patient, the problem is that this patient has airway compromise or breathing compromise. So the wheezing plus the accessory muscles can lead to respiratory distress, and that can further lead to respiratory failure. So if this goes untreated, the patient may develop hypoxia, and hypoxia may lead to death. So this patient is likely to die. So even when you're prioritizing each patient, ask yourself, who is likely to die first? Right? So the airway patient is likely to develop hypoxia, which can lead to death. So we're going to look at the bleeding trauma patient. This patient has a circulation compromise. The patient is actively bleeding, but responsive and has a patent airway. Still, perfusing bleeding needs urgent control, but not as immediate as the airway that is blocked or maybe compromised. So we have to look at that, right? You have to look at, can this patient wait a little, or who cannot wait? So you have to look at it like that. Who can wait and who is not able to wait? So these are the things that you think about when you're analyzing the patient. So let's go to step 3. Step 3 now is where you decide who you will see first. Having done your assessments and having using the frameworks of prioritization, airway always triumphs circulation. So the asthma patients with airway or breathing compromise, they are going to be prioritized first. Because if these patients stop breathing, circulation won't even matter at that point. So you have to address the airway compromise. So the correct answer is that you will see the asthma patient first. So the NCLEX rationale is that airway obstruction or respiratory failure can kill within minutes. Bleeding is critical, but as long as the patient has an airway and is breathing, you have a window to act after stabilizing the airway. Compromised patients. So I want you to bear these tips in mind for your NCLEX, and when dealing with scenarios for NCLEX, how do you prioritize? Who do you see first? So I hope this was very, very helpful for you in order to do your prioritization questions for NCLEX. So thank you for listening. Thank you for reviewing this case study with me. Thank you, and see you in the next video. Who knows what we'll do next? It is always going to be something fun next time. See you. Thank you very much.